Hi, Dr. Yass here. And I want to talk about a diagnosis that finally has to be put to rest regarding the cause of the symptoms you're experiencing, anywhere from your lower back to your gluteal region, your front thigh, your side thigh. There are way too many people getting the diagnosis of either a herniated disc, stenosis, or a new nerve root impingement at L45 as the cause of their symptoms. Let's put this to rest once and for all. What you need to know is that every one of those nerve roots that are coming out of the spine, such as L45, innervate a certain area of skin called a dermatome. What you need to understand is that the L45 nerve root innervates an area of skin that basically wraps around from the back, wraps around the front thigh, down to the inner shin on a spiral. It looks just like this. So, either you have this symptom, which is pain that's or altered sensation wrapping from the back around the thigh on a diagonal pattern down to the inner shin, and that represents what you would expect to have if you have an L45 nerve root impingement creating a symptom, or the L45 nerve root impingement, herniation, stenosis is simply existing but not significant enough to be creating a symptom and has nothing to do with your symptom anywhere else in your body. I don't care if you have pain at your back. I don't care if you have pain in your butt, the side of the thigh, the side of the hip, the groin, the front of the side. I don't care where your symptom is. If someone is telling you that the cause of that symptom is L45 nerve root impingement, stenosis, or herniated disc, you are being lied to. The only symptom that you could derive that would be associated with an L45 herniation, nerve root impingement, or stenosis is a symptom in the dermatome that represents the L45 nerve root, which again, as you can see, is pain from the back around the lateral thigh, across the front of the thigh to the inner shin. If that's not your symptom, the identified L45 nerve root impingement, stenosis, or herniated disc is simply an independent variable, not significant enough to create a symptom, and does not need to be addressed, and is not the cause of your pain. So ignore anyone telling you that in fact is the cause of your symptoms and requires some sort of treatment, such as surgery or an epidural nerve block. The time has come for facts to be provided so that lay people are no longer dependent by faith to depend on a system that is unwilling to show things for what they are and treat people appropriately so they can have their pain resolved and have the life they justly deserve. If this rings true to you, maybe you've had 1, 2, 3, 4, or 5 back surgeries that didn't work. Maybe you've had a bunch of epidural nerve blocks that haven't worked. And now, after this explanation, you understand why your pain has not been properly treated, or the cause has not been properly treated. It is time for you to get the Yass method for pain-free movement, which ignores diagnostic testing and actually interprets the body's presentation of symptoms, which says that every tissue, whether bone, muscle, or nerve, creates a very specific symptom. So interpreting the symptom allows you to know what tissue it is. The Yass method has shown in over 30 years that in more than 98% of cases, the cause of pain is muscular, even when positive MRI findings are identified. If this makes sense to you, get the Yass method, get the proper diagnosis, get the proper treatment, and get your life back and get out of the existing medical system. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.